Today the question here is whether efforts by Horizon and other carriers who offer healthcare plans to insured on a tiered basis, arbitrarily designating some hospitals Tier 1 and others Tier 2, is either adequate or within the public interest. Sadly, both Horizon and our Department of Banking and Insurance turned down our request to testify, and I think this is an important healthcare issue that will determine the affordability for many people in our state, particularly those in urban areas. Also, sadly, the DOBI, under the lead of an acting commissioner, took no active role to ensure that the plans were either adequate or within the public interest, at least in my opinion. If you take the capital city of Trenton, both urban hospital systems were designated Tier 2 status by Horizon, yet they were acknowledged for their price containment and performance in being the only Mercer County hospitals to offer cardiac care, trauma and psych treatment, as well as maternity care. Nearby, the only other Mercer Tier 1 hospital closed its maternity ward the previous year, offers no cardiac care or trauma as a certificate of need, and the acting commissioner, when I met with him, was not aware of this fact. The secondary treatment, the designation of Tier 2 status, was repeated throughout the state to other urban hospitals as well as Catholic hospitals whose missions have always been to serve the poor. Horizon, acting as a for-profit entity, consciously chose suburban hospitals and gave them Tier 1 status, and in effect said, we'll give you less reimbursements, but you will get a greater market share since other non-participating hospitals will be designated Tier 2 status. Strangely, the capital city of New Jersey has also been designated as a Tier 2 community by Horizon, causing its citizens who want premier treatment, particularly with regard to cardiac care, trauma, maternity care, to travel outside the county for those services. Again, DOBI sat by and rolled over. Within weeks, the tiered plan was approved. And the question is, for me especially, should we care that urban working poor who were enticed to sign on to Omni Plan, and I'm sure everyone heard a commercial on their way in, are relegated for second-class treatment both by the state, DOBI, and by the very insurance company that is so-called nonprofit entity whose mission should be to serve the public interest. So I look forward to the testimony of both the hospitals, people from the insurance community, as well as those representatives from the communities who have been designated Tier 2. And thank you, Mr. Chair.
Anyone else with a comment? I would just say that it is important for this committee, and I think some have questioned it, which has surprised me, to take up this issue. This action in the marketplace will have impacts on cost, reimbursements for hospitals and physicians. They will affect consumer choices. They will certainly impact hospital delivery. As most people know, the hospitals in their particular jurisdictions are the largest employers in their communities and drive a lot of other economic activity. And so that which affects hospitals affects our economy as a whole, and it's important for this legislature to take cognizance of that. And reflecting on the Senate hearings, I think we need to return to the questions of access to care, how that's measured by the department, whether or not regulatory changes should be sought by this legislature to, as respects access to care, particularly for those who live in urban areas. I think it's important for this legislature to have an understanding of hospital delivery writ large and what it will mean for jobs and our economy. What will the impact be on physicians who find themselves involved with both Tier 1 and Tier 2 hospitals, and what actions their patients may take in respect to these new insurance plans. So there are a number of issues here which will need to involve policymakers at the state level. I am a big fan of hearings such as this to bring these issues to the forefront in the public space so that certainly my colleagues here in the legislature but the public at large has an opportunity to look and understand changes such as this that has that touches on what for many people is a top-tier issue. What will be my interactions with my physician? If I need hospital care, where will I get it? Where will my family member be able to get that care? And what will be indeed the viability of the hospital that serves my community? Where communities have lost hospitals, the impacts have by and large been very negative. And so we need, as a people, as a community, as a government, to pay close scrutiny to the regulatory process that impacts hospitals as greatly as this one portends to, and great scrutiny to the impacts on patients and their access to care as this plan posits it will, and whether or not, and what the negative externalities of any of those actions will be on our community. So I look forward to the testimony today.